Happy Patient Experience Month. My name is Dr. Brant Oliver. I'm the Associate Chief Quality Officer for Patient Experience here at Dartmouth-Hitchcock. I'm happy to serve as the moderator for today's panel. I oversee the Office of Patient Experience at Dartmouth-Hitchcock, which includes 6 departments that make critically important contributions to the care experience for patients and families, 3 of which will be highlighted today. These include Arts and Humanities, Chaplaincy, Patient and Family-Centered Care and Patient Relations, Interpreter Services, Service Excellence, and Volunteer and Guest Services. At Dartmouth-Hitchcock Health and around the globe, healthcare organizations have celebrated Patient Experience Week each April. For the past 7 years, Dartmouth-Hitchcock has celebrated the patient experience by honoring the people who impact patient experience every day for patients, their families, and caregivers. Today, we're going to talk about how 3 departments in the Office of Patient Experience, Arts and Humanities, Chaplaincy, and Interpreter Services, contribute to and can have a profound impact on the overall experience of the people we serve. Next, I'll turn to our distinguished panel for introductions. Marianne, let's go to you first. Welcome.
Thank you so much, Brant. I'm so happy to be here to be able to explain what my department does. My name is Marianne Barthel, and I'm the Director of the Arts and Humanities program for Dartmouth-Hitchcock.
Great to have you with us, Marianne. Frank, let's go to you next. Welcome.
Thank you, Brant, for leading us today and showing, our contributions to patient experience. I'm Frank Macht. I serve as the Director of Chaplaincy here at DHMC, and as part of that work, I'm also responsible for our educational program with chaplain interns and students.
Thank you, Frank, and welcome. Great to have you with us. And last but certainly not least, Sam.
Thank you very much, Brant. Hello, everyone. My name is Samuel Verkhovsky, and I am the System Director of Medical Interpreter and Translation Services for Dartmouth-Hitchcock Health.
Sam, it's great to have you with us, and let's stay with you to kick us off. Maybe you could help us to understand a little bit about the magnitude of the need for the services that you oversee. How many limited English proficiency patients does Dartmouth-Hitchcock see, and what kinds of interpreters do we work with?
Yes, absolutely. We see over 100 limited English proficient and deaf patients with over 130 appointments per day at Dartmouth-Hitchcock Health on an average day. We have had almost 16,000 unique limited English proficient and deaf patients in the last 10 years. We've counted 126 languages spoken by these patients. The most frequent among these is Spanish, which comprises 43% of all of our non-English spoken languages. We work with an in-person vendor company based in Manchester called Language Bank. They provide us in-person interpreters in up to 60 languages. We also work with another vendor company which provides us video, remote, or virtual interpreters, as well as telephonic audio interpreters. And we can access 40 languages by video or 151 languages by audio in this way. We also work with American Sign Language vendors, and we have a few staff interpreters for American Sign Language and Spanish. Lastly, I just wanted to say that our 10 most frequently spoken non-English languages are Spanish, Vietnamese, Arabic, Nepali, Mandarin Chinese, Portuguese, French, American Sign Language, Bosnian, and Russian.
Sam, that's quite a wide latitude of services provided. And I imagine one of the biggest challenges for people needing those services is knowing exactly what to do and how to do it and where to go. What are the most important things that limited English proficient and hearing impaired patients should know about when working with medical interpreters?
Yes, thank you for the question. We work with professional medical and American Sign Language interpreters. Patients will never burden the cost of an interpreter. That's something important that patients should know. And professional interpreters are as important for your providers as they are for you. We ask patients, what language do you prefer to discuss your health information in to best identify a patient's language needs? Professional interpreters are trained to relay everything that is being said between you and your doctor and healthcare team. We only use professional interpreters appointed by Dartmouth-Hitchcock, and we ask that family and friends not be permitted to interpret. There's a lot at stake when it comes to your health, and therefore we only use professional interpreters, as they are trained to be thorough, accurate, and not to miss or change anything that is being said. Plus, they must possess a very strong knowledge of medical terminology.
I imagine that the flip side also holds. As a practicing clinician myself, I'm a nurse practitioner. I may have some questions in my mind about how do I access interpreters? When is the right time and what's the right way to do this? What are the most important things that providers and staff should know about working with medical interpreters for helping limited English proficient and deaf patients?
Yes, well, thank you. And I'm very happy to answer that question. So not only is it important to know that it is the law that we provide meaningful and effective language access services, but the medical literature is really abundant with evidence that limited English proficient and deaf patients have poorer health outcomes and poorer access to healthcare than English speaking patients. The Joint Commission states that known risks to LEP, limited English proficient, LEP patients include greater risks of medical errors, line infections, surgical infections, falls, pressure ulcers, and longer hospital stays, surgical delays, and greater chance of readmissions for certain chronic conditions due to difficulty understanding how to manage their conditions, how to take medications, as well as which symptoms would prompt a return to care or when to follow up. Limited English proficient patients are also less likely to receive preventative care, have access to regular care, or be satisfied with their care. When a patient has a language barrier, that now becomes also a language barrier for the doctor and the healthcare team. Therefore, professional medical interpreters are not just utilized to enhance the patient experience, but to ensure that communication has been mutually understood so that we can provide safe and effective care.
I think that's a powerful statement, Sam, that this isn't just about improving experience, it's about improving outcomes, and linking people to appropriate interpreter services can make a real difference in both places. Sam, thanks you very much for your commentary. I'm going to loop back to you a little bit later. Next, I'm going to go to Marianne, who has a department that approaches patient experience from a very different perspective, from the arts and humanities. Marianne, give us a sense of why Arts and Humanities is positioned within the Office of Patient Experience. Why have an Arts and Humanities program at a hospital and health system?
Thanks so much for asking. That's one of my favorite questions. We have three major reasons why we would have an Arts and Humanities program in a hospital setting. One is to create a healing environment for patients, visitors, and staff. It is also an integral part of Dartmouth-Hitchcock's holistic approach to care for our patients. And thirdly, we also participate in research that demonstrates the value of engaging with the arts and how that improves your health and well-being.
Excellent. And give us a sense, I imagine, you could talk for quite a long time of the full breadth of programs that your department has, but give us a sense of some of the highlights. What programs are available for patients, families, and staff from your department?
Yeah, we have quite a menu, as you referenced, of opportunities for people to engage with the arts and humanities, whether you're a patient, a visitor, or a staff member. For instance, we have a creative arts program here, and that consists of a therapeutic harpist, a visual artist, and a writer in residence. And they meet both with patients, family members, and they also do programming for staff. And they utilize those different modalities to process their health journey or process difficult situations in a work setting, and also to lower stress. Research shows that engaging with the arts can have a biological as well as psychological effect on your health in a positive way. We also have volunteer musicians who perform throughout our campus here in Lebanon to help create that healing and soothing and relaxing environment for all who walk through our doors. We also have writing circles that patients can participate in, art classes, vocal workshops for people with Parkinson's and other disorders, and partnerships with other community organizations like the Hood Museum of Art at Dartmouth College to offer programming to our senior populations.
Thank you, Marianne. And, what struck me about that, similar to Sam's presentation, is that these services improve the experience, but also can improve outcomes for people that are seeking care. And also in our environment of increasing sensitivity to diversity, equity, inclusion, and belonging, the arts can have a big role in bringing that to bear in a very positive way. So thank you very much, Marianne. And I'm going to move next to Frank, who has his department contributing to patient experience in a third and very important way. Frank, welcome. And I'll start off with the first question about the opportunities in spiritual care. Where do you see opportunities to expand our spiritual care services for patients and caregivers in our healthcare setting?
Well, thank you for your question. Traditionally, we would expect chaplains in spiritual care, to be available in the inpatient setting. And that's certainly in some ways our bread and butter opportunities to connect with people who are displaced. They had an acute health crisis or maybe are hospitalized because of chronic issues popping up again. And chaplains traditionally support people during this, very stressful time and give opportunities for people to reflect on their experience, the patient experience, while hospitalized. But over recent years, our discipline and also I and our team have thought more about, well, people are not only sick or stressed out when they're hospitalized. Many people deal with long recovery periods or with chronic health issues that stay with folks for months or years or even lifelong. And I would think there's opportunities for integrating spiritual care and the work of a chaplain as a accompaniment on life's journey and somebody's health journey, even in the outpatient settings. For example, our geriatric chaplain has worked in leading support groups for patients and also for caregivers, at our Aging Resource Center. She is embedded at our general internal medicine clinic, and offers support to people on their health journey. And ideally, that leads also to continuity of care when people are hospitalized and they already have a connection, maybe with their chaplain that they know out of their clinic. I think there are plenty of opportunities to expand that in different specialties as we're also becoming more research-based and want to determine, well, what is the ideal time and what is the patient population that would benefit the most, from those services and that kind of accompaniment, that a chaplain could provide on life's journey.
Thank you, Frank. And just like in Sam's Department of Interpreter Services and Marianne's Department of Arts and Humanities, even though we're under the umbrella of patient experience, our services also touch upon the staff and professionals here. And that is certainly the case in your department. I understand you provide a number of services for staff. Can you tell me a little bit more about those?
Sure. I mean, one benefit of providing services to staff is that many chaplains are embedded as colleagues on the interdisciplinary team, again, especially in the inpatient setting. So we work side by side for the benefit of patients and their families, but traditionally chaplains always have a listening ear. How is the staff, how are our colleagues doing? And that, of course, has ever more increased with the demands of healthcare ever increasing, and then especially during the COVID crisis that put a lot of burden, as everybody in the nation and the world knows, on healthcare workers. So what we do is often be available, for debriefings. Historically, when there was a particular crisis, we often partner with the Employee Assistance Program in providing those. But what has really been growing over the last 4 or 5 years are our so-called Tea for the Souls, where our chaplains proactively and sometimes in response to crisis situations go around and visit on inpatient units or even in other departments and with teams to give people a little break and a time to reflect from the busyness of their work. That may lead to conversations about, well, the work stresses, but also, of course, we have personal lives and people have stresses at home, worries about elder care, teenagers, children, especially with school being so complicated for many parents. So chaplains also walk along there and have that listening ear and presence for folks to decompress a little bit in the middle of their busy days. And those times are rare and rare to come by because nurses certainly, at the bedside sometimes even don't have time, to go and have a lunch break, or have to wait a long time to go to the bathroom. So when a chaplain shows up, and gives that minute or two, to have a cup of tea and think a little bit about their day, it's much appreciated and very well received.
Absolutely. Having that space introduced for a little bit of healing is critical. One thing that really has struck me through our conversations, Frank, in my time here is how deep the discipline of chaplaincy is and where it's heading in the future. And we've talked a bit about this idea of spiritual health as a future direction for where chaplaincy may be going. Tell us about spiritual health and how that might change the future of chaplaincy.
Yeah, I think it's a fairly new concept in our discipline that's explored, again, also in the context of research, which our colleagues here also talked about, where's the evidence that the arts, and having professional interpreter services available, not just as a kind of nice or good service in addition to providing good medical care, but actually essential to the outcomes. So as spiritual care, I would say, becomes more research-driven, we're also looking at what is the evidence and what is the outcome. How does it make a difference of what I said, like an accompaniment of a chaplain, of having a listening presence, of being able to reflect? How can we demonstrate in more consistent fashion that this actually contributes to spiritual health and well-being? Meaning one's innermost self, one's spirit, independent of a faith tradition or a philosophy on one's values, is actually nourished as a motivator in life, to also face maybe acute and chronic healthcare issues. So it puts a little bit of responsibilities on our teams to be even more intentional, to think about where do we put our resources to have a lasting impact, beyond providing, comforting presence while somebody is in distress. So we want to think a little bit more longitudinal and outcome-oriented. And I think the term spiritual health, is actually a very good gateway or an aspiration to lead us in that direction.
Well, thank you, Frank. I'm very excited to see where that goes. And for me, it expands the spectrum of what health is. We think a lot about medical health and mental health and population health. We often forget that spiritual health is a piece of that picture. And to see that grow and get cultivated and more defined and even studied will be very exciting to see in the future.
Yeah, thank you, Brant. I mean, Marianne commented on that and spoke about, holistic health. We often talk about health in body, mind, and spirit. So we can be more intentional about integrating, spiritual health into the overall services that we provide.
Absolutely. I'm sure that after people are watching this panel discussion, they're going to want to access our services. And so let me bring all of our panelists back together now. And starting with Sam, if I want to access a medical interpreter or interpreter services, how would I go about that?
Yes, well, thank you. So do you mean as a provider, as a staff member, as a patient?
Yeah, all of the above. Maybe give us a sense of how, if I were a patient, how would I access it? And if I were a provider, how would I access it?
Absolutely. So if a patient when we can perceive that a patient has a language barrier, and really we've identified that the best way to identify that is to ask, what language do you prefer to discuss your health information in? So when we, the moment we understand that the patient has a language barrier, all the patient can do is ask for an interpreter, and we make our contact information widely available. We have, at each of our major sites, we have people who are interpreter services coordinators. We call them master schedulers, but we are available by email, by phone, and we are staffed full-time and available to in real time address people's needs to obtain an interpreter. And we can provide interpreters either in person or video remotely. We have 124 devices across our larger system, as well as telephonically, which is not device dependent. And so that's how we can access interpreters.
Thank you, Sam. And Marianne, let's go to you next. How do you reach the services available through the Arts and Humanities Department?
Well, actually, there are quite a few ways. If you happen to be on campus in Lebanon, just walking in our doors accesses our services with the beautiful music, our 8 gallery spaces, our special art exhibits that we host to have community discussions about issues that are important to our community. And we use art as a vehicle for those discussions. But if you're looking for more concrete projects per se, or a visit for a loved one, you can contact us at creative.arts@hitchcock.org. And all of our services are available to all patients throughout the system. We do have the opportunity for video contact with folks, whether it's through Zoom or a telephone visit. So if you have a loved one in a different hospital, or if they've gone home, similar to Chaplaincy, we are able to continue services once patients have left the building. And many of our programs, such as the art classes and writing circles, people do remotely, thanks to the pandemic, actually. We are much more adept at incorporating people from a distance who might not be feeling well enough to come all this way.
Thank you, Marianne, and also for highlighting the virtual connectivity capabilities. That's really important for us to keep in mind. Frank, let's finish with you. Tell us how to access the services of chaplains that are made available to patients and families.
It's fairly simple. As patients or family members here at Dartmouth-Hitchcock Medical Center, if you are here during the daytime, you could walk into our office, which is right next to the gift shop on the mall. You could call there, or which is easier from a patient room, you just let any healthcare provider or your nurse know, and they can certainly put a consult order in or give us a call. In an emergency basis, you know, we are also available 24/7, 365 days a week, and have somebody either in the house or come in even at night or on the weekend. I'll add one thing as how do you access our services as a provider, you know, as a nurse. I would recommend that actually if you perceive, you know, any spiritual distress, emotional volatility among your patients, just put a consult order in or let your unit chaplain or us in the office know, because many patients actually underreport, you know, their own need if they were directly asked, do you want to be seen by a chaplain? They may say, oh, I'm not religious, you know, I haven't gone to church in a long time, or I'm fine, I got a resource out there. But little do they know that we cover the whole human experience, so to speak, not necessarily a faith experience. Sometimes it scares them. They think, oh, a chaplain, am I dying? Do you have bad news? No, we want to be part of your journey, you know, towards wellness. So from a provider point of view, just think, you know, are people at a crossroad? Are they distressed? And then just make a referral. We will see them. And if they actually decline a visit or a chaplain visit because they did have a bad experience, you know, with a religious group, or then certainly we're trained to respect that and make a graceful exit.
Well, thank you, Frank. And I'll sum up this segment by just reminding those of you that are watching that you can also look in the resources accompanying this video for information about how to connect with all of these services. Now I'll move to our final closing comments. So we're going to start first with Marianne. Marianne, I'm sure there's only, you know, with this amount of time we have, we can only touch the surface of what your department does and its contributions. Is there anything that you would like to share with the audience to take home as a key highlight or take home point?
I think the most important thing is to recognize that we all know intrinsically how good it feels to either listen to music or engage with art, whether visually or creating it yourself or journaling. And now the research is out there to support that it does really make a difference in your well-being.
Thank you, Marianne. Let's go to Sam next. Same thing, closing comments for you, real take-home points that you'd like the audience to take with them.
Yes, absolutely. Well, thank you. You know, what I'd like to say is that frequently a gray area that we need to be aware of is oftentimes patients might overestimate their level of partial English and try to get by, or may be proud of their independence. Whether they're an immigrant or a refugee or some reason like that, and and not appreciate how complex a clinical visit may be and the level of language that is required. Similarly, providers may think that they're getting by okay, and they have been getting by okay with family attempting to interpret, but really these are areas of known risk. So I try to just advocate as much as possible. Please use professional medical interpreters.
Thank you, Sam. And Frank, the final comments are to you. Key take-home points for chaplaincy and spiritual health.
I'll give an example that is fresh of my experience rounding and shadowing with a chaplain intern yesterday. We visited a patient who thanked us actually for the visit, although he would have never asked for it, not being particularly religious. But I asked at the end, well, what difference did our intern make? How was it helpful? And he thought for a moment and said, you gave me time to pause and reflect on my experience here. This was following a major cardiac event, and we had a wonderful conversation, looking back what happened, but also looking forward on the journey of recovery, and having somebody to bounce off your own experience and feelings with was very helpful. So the take home is, it's about your human spirit, and any kind of healthcare event is at the minimum stressful, if not, life-threatening, and anywhere in between, to pause and reflect with somebody who's trained to do that, and do that in a caring and supportive way, could really make a difference on your journey.
Thanks so much, Frank, and to all of you, Marianne, Sam, and Frank, for being with us today and for all the contributions your departments make to patients, families, and staff. Please join me in thanking our panelists and recognizing the many contributions that the departments in the Office of Patient Experience make to the care experience of patients, families, and staff. I'd also like to thank Jody Stewart, Manager of Service Excellence, and the Patient Experience Month Planning Group for organizing this important activity. Most importantly, thank you for being with us today, and we look forward to serving you and the DH community in the future. Also, please keep in mind that we have a great month of patient experience activities for you. We encourage you to take full advantage of these activities and hope that you enjoy Patient Experience Month. Take care.